The Chicago classification of esophageal motility is a standardized system used to interpret esophageal high resolution manometry (HRM) studies. It categorizes esophageal motility disorders based on patterns of pressure observed during swallowing. The most recent version, version 4.0 2021, introduced significant updates. Here's an overview. Key components: 1. Integrated relaxation pressure (IRP) measures the relaxation of the lower esophageal sphincter (LES) during swallowing. 2. Peristaltic integrity assesses the strength and coordination of esophageal contractions. 3. Distal contractile integral (DCI) quantifies the vigor of esophageal peristalsis. 4. Esophagogastric junction (EGJ) morphology evaluates the structure of the LES and crural diaphragm. Classification of disorders. The Chicago classification divides esophageal motility disorders into three major groups. 1. Disorders of EGJ outflow obstruction. Achalasia subtypes. Type 1, classic achalasia. Absent peristalsis, non-relaxing LES. Type 2, achalasia with compression, absent peristalsis, penesophageal pressurization. Type 3, spastic achalasia. Absent peristalsis with spastic premature contractions. EGJ outflow obstruction, elevated IRP without meeting criteria for achalasia. 2. Major disorders of peristalsis, distal esophageal spasm, premature contractions with normal EGJ relaxation, hypercontractile esophagus, extremely high amplitude contractions. Absent peristalsis, no significant peristaltic activity with normal or abnormal EGJ relaxation. 3. Minor disorders of peristalsis, ineffective esophageal motility, IEM, weak or failed peristalsis, 50% ineffective swallows. Fragmented peristalsis, breaks in the peristaltic wave 5 centimeters. Updates in version 4.0. Greater emphasis on context, symptoms, and other diagnostic findings. Use of adjunctive tests, e.g. provocative maneuvers, functional luminal imaging probe FLIP for borderline cases. Clarification of EGJ outflow obstruction as a borderline condition that may require additional testing to confirm clinical significance. Incorporation of impedance measurements in specific contexts. Clinical utility. The classification helps guide 1. Diagnosis of motility disorders. 2. Treatment decisions, e.g. medical therapy, endoscopic or surgical interventions. 3. Research in esophageal motility disorders. It's important to interpret the results in conjunction with the patient's clinical symptoms and other findings, such as endoscopy or radiology.